everyone. My name is Isan헌. I'm a leading universe. I would like to briefly introduce our company to all of you. We are a cloud-based digital healthcare leader, and we would like to innovate
클라우드
healthcare system by utilizing our technologies. I know that this is utilized in many different healthcare, but maybe this is your first time hearing about our company. Before I became a businessman, I was a orthopedician, and I developed a medical device that uses a spine treatment without any surgeries. And because I became a researcher and developer, I decided to talk about or challenge our future treatment, future care, and I was leading this type of research and I was assigned as a national project leader and researcher. I decided to combine cloud and big data into medicine, the field of medicine. And this project was completed successfully. And you can see that for the first time in Korea, Korea University Medical Center is now being operated on cloud. And last year, as a result, I was awarded with the merit of Medal for National Merit. So you can see that we are preparing for the fourth industrial revolution, and we would like to build a hospital information and data collaboration tool using cloud. And back in 2019, even though we are creating hospital information system using cloud, in order to actually realize the vision, the company has to be there and to spread the system. We can't just simply develop and invent and stay there. In order to realize our dream, we needed a company. That is why I decided to build this, and we attracted Series A investment from Naver, which is 2 billion Korean won, and we also got another round of funding as well this year. So people talk about fourth revolution, industrial revolution, then we have to think about how is it different between the first three industrial revolutions versus the last, the fourth industrial revolution. In the past, it was mostly about increasing the supply, steam engine, vehicles, electricity. That's the supply of revolution. Whereas if you look at the fourth industrial revolution, it focuses on consumption. If you think about autonomous driving, you have to provide customized service to customers to prevent collision between cars. To enable this environment, you have to understand the consumers by utilizing sensors, 5G, cloud, big data, artificial intelligence. And by converging these elements and technologies, you can provide customized data to a specific vehicle. So I think the same goes for medical areas as well. You have to monitor similar patients that are 10,000s or more in number who have a very similar trajectory when it comes to your own disease, and you compare the data, you learn what was effective for them, and use the same cure or treatment. So you have to collect the data, including genes, very carefully and cautiously. You have to look at the current system. There are different terminologies. All the data are existing in silo. And if you want to combine all the data, you have to put in a lot of resources just to map the data together. But usually you tend to use just one hospital for data. But let's say at cloud, there is the best hospital system, management system, and if you use it for as like a crowd funding or pay, then even though you belong to a different hospital, you can collect the same class of data. And I believe that this combination and gathering of data will be able to provide customized care and services to us. So let's watch a video together.
연결한 개인의 유전체.
What is precision medicine? It is including gene and habits and personal information, and by gathering the data points, you provide customized care. If that is so, cloud-based hospital information system, what does it mean? PIHS is innovative. The existing IHS system, whenever a patient enters a hospital, you would have to provide your information separately every time. But under the current system, even if you go visit a different clinic or hospital, there is a continuation of care. So, precision IHS is also very economical. You can say that the cloud-based hospital information system will enable the collaboration and mapping of different data points. You can save costs for managing the data. You can also encourage sharing of data between hospitals, so you can suggest customized care and prevent overlapping and redundant diagnosis and tests. The PIHS system is also very productive. The PIHS system has no limit in terms of time and space and can share accumulated data that can encourage collaboration and research by multiple doctors. And this will lead to the nurturing of talent, which will contribute to the increase of national capabilities. The system is also efficient. Storage and performance can be improved quite easily, and data backup and security system will be maintained under the anonymous environment, so there's less chance of privacy information leak, and comprehensive diagnosis and visuals and customer and patient information will be shown as a dashboard so that doctors and physicians can utilize it very efficiently. And you can also use visuals so that nurses can refer to the ongoing process of patient's care. And mobile EMR, live log based PHR, chronic disease risk care, intelligent POC prescription guide will be added to the system as well. Starting from Korea's Annam University Hospital, after the stabilization period, we are going to expand to other locations as well. Large hospitals' IT systems can be adopted at small, medium-sized local hospitals. Precision Hospital Information System. The time for treatment is going to be shortened, effect will be heightened. With precision technologies, there will be the fourth industrial revolution adopted in the medical industry, the total innovation of hospital information system. It's a perfect completion and employment of IHS. And at the center, there is cloud-based PIHS. As you saw from the video, so far, if you look at what has happened around the world to care for cancers and rare diseases, there was no case where we uploaded data on cloud, but for the first time in Korea, uh, thanks to the support from the central government, we successfully uploaded the data on cloud. When we first tried, everyone said, "Oh, this is not going to work." All the other partners, including Samsung SDS, they said it's quite risky. There is not this is not going to work, and they said, why don't we just apply it to a small local hospital instead of the Korea University Hospital? But if that happens, that big data is not so meaningful or remarkable. If we want this to be useful for cancer patients and rare disease patients, you have to target a center that is large scale, which has comprehensive data sets already stored. So as a result, we targeted Korea University Anam Hospital, and this worked. So all three hospitals under the Korea University chains, Anam, Guro, and Ansan, they're all being operated on PHIS, and the officials there don't know whether it's on cloud or not. They just use it without the, feeling the difference. And Samsung STS invested 100 billion won, and then the government fetched 30 billion won, and Korean University Hospital also invested additional 50 billion won, so that all the patient-related systems are established. So I would say that the research size when it comes to funding was 180 billion won, and because the information is now uploaded on cloud, all the other hospitals they can just simply subscribe to it and then use it. And because it's a shared economy, they will be able to benefit from the best program and best system with economic benefit. And Samsung Hospital, Korea related university hospitals could be their partners so that they can build new AI solutions in the future. So, as I shared earlier, the system is innovative, economical, and aligned with 4IR technologies. And I think what's most important is its security. We are using Naver Cloud, and after the foundation of Naver Cloud, there was no meaningful security accidents that have occurred at Naver. Hospitals every year, even major university hospital, there are security leaks and accidents that happen regularly. But on cloud, just like how we put our money on banks safely, um, there is less likelihood of leaking the data, unlike a personal wallet or how we save our money individually. So, what's important in big data is, of course, standardization of clinical jargon and codes, and we have been working hard to standardize the expressions and jargons, and these words are going to be used, and the ADM MDM service will automatically update other hospitals' usage. We can diagnose, address, and evaluate their jargons, and all the data or standardized expressions and codes are going to be adopted, and these ones are aligned and mapped with global jargon as well. So what's expressed here in the crimson color, even though we are different hospitals, we use the same jargon. So basically, all data sets can be utilized as if they exist in one hospital. In the past, you had to map them before, so only 20% would be used for CDW. It's okay, it's quite useful if you want to just look at the trend, but to be able to actually build useful AI system, I would say larger coverage was necessary, and we finally made it. And by combining all data, including life log data, clinical data, and genomic data, you can see that it's an integrated platform that deals with all different types of data. And you can see that all systems were developed by modules. So a hospital can use as many modules they want, and then depending on how many modules they use, they'll be charged accordingly. And because it's uploaded on cloud, the benefit is that you can utilize open API gateways for making or exchanging interfaces. So if it's already uploaded on Naver, then it's easily accessible. For example, electronic user agreement or insurance automatic billing. What they had to do was they had to come and develop interfaces to get the data, attract the data. But because it's on data, all hospitals that use PIHS can use it all at the same time. So I can see that our benefit, the strongest point would be security. I think more and more hospitals will flock to the cloud environment just for the security reason too. And another biggest benefit I see is that a database is upgraded into Tibero. So, in hospitals, because of the importance of data, they use Oracle, and the cost is huge. But if you were using Oracle as a database, then we will be tied to them, and there's no clear benefit. So we challenge yourself to come up with a domestic technology. And Korea University Hospital, after changing to Tivero, the cost went down by 60%. And I think other hospitals will also benefit from this usage as well. And patients, as a result, in the past, they had to click 8 times to use a service, but now they can access their information much quickly and easier. And depending on different timelines, let's say surgery records or, you know, doctor's visit records, all these tabs are readily available so they can click it and see what was discussed. It's very user friendly. And moving on to the spread of the use, there are many different costs that are related to IHA service, but the biggest cost would come from maintenance and repair. And you can see that 40, 50 people are there just for maintenance. But if it's on a cloud, then uh, let's say there's one team that'll be in charge of two, three, five, six hospitals. The number of personnel required for maintenance is not proportional. So let's say there are 20 um, hospitals, you only need about 40 people instead of having to hire 100 people. So, as a result, it's very flexible and cost effective as well. And because it's connected to university level hospitals and local governments, and the use is going to spread as well, we're going to create a council so that more hospitals can come in and utilize big data that's generated in our system. And we will also go into other markets such as Thailand with Naver. So I can surely say that we completed PHIS, we created a platform. We'll continue to build on from what we have with other hospitals and create business opportunities as well. So currently we are on Series B. Series B funding is all over. At this Series B stage, um, we said we will work on AI connected platforms, but on Series C, we're going to go global and we will strengthen our big data research. And as I said earlier, the fourth industrial revolution, we have to focus on patients and consumers. We have to provide customized precision medical care. And life data has to be uh, gathered at one point on cloud, and you have to be able to see other data that's similar to you so that you can prevent some diseases that are likely to occur in your body and then have a seamless solution to prevent that from happening. And for this to happen, more and more hospitals have to come and join the same service. That is why we created this, and I hope that more people can join our journey. Thank you very much.